I hope this finds you and your loved ones safe and healthy wherever you are. My name is Paul Shetler-Fast, and I am Mennonite Central Community's Global Health Coordinator, which means that I help oversee and support our health programming around the world. And right now, I'm trying to do that from my house here in Indiana with 2 toddlers. If you're like me watching the news, the COVID-19 pandemic can feel both overwhelming and hopeless. And I want to share something different today. There is a lot we can do. There is hope and potential to save lives if we work together. While we must be physically apart during this time, our faith calls us to be more engaged and more connected than ever. We're in this together. Now, a story of hope I'd like to share is a project with the Kenya Mennonite Church in the Mathare neighborhood of Nairobi, Kenya, which is one of the poorest and most densely packed urban settlements in Africa. Over the last 3 years, our staff and volunteers have worked to ensure that mothers there have what they need to keep themselves and their children safe and healthy. Now, understanding what a disease like COVID-19 could do in a community like Mathare that was already struggling with basic health services, our team got started on responding long before the pandemic hit in force. Judith Siamba, the project's leader, worked with frontline volunteers to set up 50 hand-washing stations across Mathare and purchased all the personal protective equipment and supplies locally so that she and her staff could continue to provide prevention education to the community. Judith and her staff retooled group sessions before social distancing was necessary and then transitioned from face-to-face meetings with mothers to doing as much as they could through phones. This essential prevention work helps mothers like Margaret Amui to understand the risks that her family faces and then take those practical steps to keep themselves well during these uncertain times. These steps matter and they can save lives. COVID-19 is upending all of our lives, but by working together we can bring hope and help mitigate the impact on those least able to afford it. On behalf of MCC, our hundreds of staff serving around the world, and our partners like the Kenya Mennonite Church, thank you. Thank you for doing what you can to help support during this crisis, both at home and around the world. Every bit helps. We're in this together.
Wait, what? There's a meet? You'll meet?
And I have one more video here that I'll try to share.
Welcome, everyone. My name is Eric Kurtz. I'm Executive Director of MCC Great Lakes based in Goshen. And I appreciate everyone, at least where I am. It's a beautiful afternoon. I appreciate you taking the time to be here with us. Pardon the informality. I'm out in my back porch enjoying the sunshine, and you might hear a rooster or a train in the background when I'm unmuted. But I want to make sure I acknowledge other MCC Great Lakes staff members on this call. Jen Steiner as our communications director, Les Gustafson-Zook, constituent relations, and he'll be talking later. Amber Falcone is our HR coordinator. Joy Detweiler, executive assistant, and there may be others on that I'm missing. So, but they're the ones who helped plan this event, and I would acknowledge that. So as we gather in this moment, in the midst of the COVID-19 pandemic, in a divisive time in our church and in society, I'm aware of MCC's beginnings 101 years ago. In the wake of the Spanish flu pandemic and in a time of divisions in the church, leaders met to respond to a call from sisters and brothers in what is now Ukraine. And in the foreword to a history of a time written written by some of MCC's founders, this is a quote I found: "By God's grace and with his help, we were successful in a large undertaking and thousands upon thousands live. By no means the least among the causes contributing to the result with the spirit of cooperation. We have long had the means to do bigger things in the Master's service. It took a terrible crisis to arouse in us the spirit to do them and to make us forget our differences sufficiently to work together effectively. Now that we know our strength, our responsibility is all the greater." And I'll repeat that last line. Now that we know our strength, our responsibility is all the greater. So today, MCC works in over 50 countries around the world. And I'm excited about our speakers. I know Les is going to introduce them later, but I met Pugeni several years ago when he was in a different position with MCC, and we we were on a common committee together working relating to climate change, and his expertise is clear, and his ability to communicate that as well. I just met Thelma today for the first time, but I'm glad that Thelma and Pugeni are in the role they're in as area directors. They are the present and the future of MCC. I'm excited to hear from them later. So thank you all again for coming, for your part in working with, in supporting MCC over the years.
So thank you all for coming, and it's great to see these videos just to have some images, but we're also very excited about having Thelma and Pugeni join us for this session. I've had opportunity to hear Thelma and Pugeni do presentations for some of our MCC staff, and I find their presentations just to be extremely stimulating and very interesting. And so I'm excited that we can share them with our alumni and friends here this afternoon. So thank you all for showing up and for joining us here on a Sunday afternoon when you could be doing other things, but this is a good opportunity for us to hear some good stories about MCC together. So Thelma and Pugeni, I have been working with MCC for quite a while. They were up in Manitoba for a number of years recently as they were getting ready to head back to Africa. They're currently based in Kigali, Rwanda. And so that's where they are talking to us through the power of the internet here. And it's amazing that we can make that kind of connection with them and with you all. Pugeni worked as a planning, learning, and disaster response person for MCC, and Thelma was an accounts clerk for MCC Manitoba during that time. But they've also spent a fair bit of time working on the ground before they took this program role, which they're currently the MCC Area Directors for Southern and Central Africa and Nigeria. And we're just excited that they're here to join us today and are willing to share some of the things that are happening with MCC, partly around what's happening with COVID, because it's a great opportunity to get an update from people that are actually on the ground, and also just to hear some other stories about things that are happening. So I'm going to turn it over to Thelma and Pugeni. Thanks so much for being here, and we're just excited that you can join us.
Thank you so much for inviting us and for the privilege to talk to you all. We really appreciate this. As Eric said, I do have a very strong relationship with Eric, working together on climate change issues. I also have enjoyed talking to people in the United States in general on some of MCC's work. So having this privilege for me to come again and talk to you today is a great pleasure.
Yes, thank you very much for inviting us to talk to you today. We look forward to our time together and to questions at the end.
Lars, do you want us to proceed into the presentation, or we can just wait for now?
Nope, we're ready for you to just go ahead. So go ahead.
All right, thank you. So today we are going to share with you stories about MCC's COVID-19 response in Southern, Central Africa and Nigeria. We all know that when the pandemic hit the world, it was a time of panic, it was a time of pain, and it remains a time of pain up to now. There was uncertainty, there was fear. People were not sure what was going to happen next. We worried about those that we love, that are the most vulnerable. We prayed for God's mercy and healing on his world. Today, Thelma and I are going to talk to you in ways that I would describe as celebration for what MCC has achieved so far in responding to COVID-19. Not because this is a time of celebration. We know this is a heavy time. This is a time when people are sick in hospital. People are scrambling for vaccinations. This is the time when the world is showing its true colors about who cares about those who do not have and who doesn't. It's a time when people are asking many questions about who is getting the vaccine and who is not. It's a time when many people across MCC are also watching in despair and trying to advocate and challenge policymakers and governments on the distribution of vaccines. Thelma and I get that. We understand it. Dark as the clouds are, we thought that today we can just share a little ray of light, something positive that is happening because of the support, because of your prayers, and because of your thoughts, especially to the work that MCC is doing around the world. Perhaps we'll start by talking about the challenges. The challenges that people face as a result of the pandemic are multifaceted and complex. They are complex because Africa, Southern Africa, Central Africa, and Nigeria, where we work, all face challenges with climate change. They are already facing a lot of food insecurity as a result of poor soils, as a result of climate change, and of course, poor access to markets for seed inputs. On top of that came COVID-19. Because of COVID-19, there was forced migration and displacement. Some people, I see Tim, I see Suzanne, I see Bob and Judy, you know this place very well. You might be wondering, forced migration and displacement was happening well before COVID. But as a result of COVID, there was a new form of forced migration. People lost jobs, especially those that had migrated to other countries. And when they lost jobs, they were not able to pay rent. They could not put food on their tables. So they crossed borders coming back to their countries of origin. However, because of government restrictions, their countries of origin were no longer accessible because countries were now concerned about people who are crossing borders, spreading the disease. So these people had no choice except to cross borders illegally. There are many stories about people crossing the Limpopo River from South Africa back to Zimbabwe, people drowning and being eaten by crocodiles as they are trying to cross. There are also cases of people being taken by the government into unsafe quarantine centers as they try to cross. So this was the new form of displacement that happened. Gender-based violence was on the increase. This was because of the lockdown measures that governments had to put in place to control the spread of the disease. With the pandemic also came an increased burden for women caregivers. Traditionally, and as we already know from the historical way that Africa responded to HIV and AIDS, women were the main caregivers. And they did pick up the challenge to be caregivers even during the COVID-19 pandemic. This meant that women were more vulnerable and more exposed to the risk of infection. Threats to food insecurity as people were scared of going to their fields. In Southern Africa, people work in groups. When they are farming, they sing and dance, help each other. They pray for the rain in groups. They also do harvest ceremonies in addition to rainmaking ceremonies. A way of life was disrupted as a result of COVID in ways that we may not imagine. Power dynamics in decision-making. Who gets that mask first? I do have mine here, a homemade mask. This became a tool that signified life or death, especially for the most vulnerable. So if a family could only afford one, who gets it first? Mom or dad? Children, girls, boys, who gets it first? There was conflict, power dynamics. Then information access was a challenge. We also saw the United States, the biggest democracy and the most powerful country in the world, scrambling to understand how to manage and prevent COVID-19. What about Rwanda, a tiny country right in the center of Africa with no access to internet and no access to information? What about Zimbabwe, where the economic meltdown has meant that the Zimbabwe Broadcasting Corporation cannot function effectively as it should, and all the internet booths or the internet infrastructure is non-existent. Health and education systems were disrupted, and traditional and indigenous knowledge systems that people value so much were challenged. Now, the biggest challenge that also came was that COVID-19 was not discriminatory. When we talk of food insecurity, the aid workers come to help communities, and in most cases, the aid workers will be food secure. In this case, because of COVID-19, both aid workers and the communities that they serve were equally vulnerable, and they all needed protection. Organization systems of NGOs, powerful as they are, in some ways because they control resources and distribute resources to poor countries, were also challenged by the pandemic. New ways of working were needed.
And so because of all of these challenges that were now being faced, and especially exaggerated by the existence of COVID-19, MCC, as well as its partners, had to find new ways of working together. And amongst other things, protection of partners, staff, and the community had to be emphasized. And this was done by also engaging local stakeholders, such as the police, as well as the health service providers. You'll see in the picture below, our partner, one of our partner organizations, standing with the police officers as well as prison service commissioners, working on ways that they could help protect the community, help protect the staff, as well as the partners. Most of our partners were deemed essential service. So even during the time when COVID was at its peak, they continued to work. And you'll see in the picture in the middle, as well as the picture on the top, those are pictures of some of our partners having a meeting outside, planning their week, as well as the first picture holding a banner on COVID prevention.
As we said, thank you for your support. Thank you for what you do every day to support the mission and vision of MCC. Thelma and I acknowledge that these are hard times, but MCC is at work bringing hope, bringing peace, relief, and development in the name of Christ. Food distributions continue to be implemented by MCC, even during the COVID pandemic. MCC came up with new guidelines on hand washing, social distancing, use of masks, as they work with refugees and people that are affected by food insecurity. As you can see on the picture on top shows people lining up for food, the way they would do before the outbreak of the pandemic. People would stand in lines close to each other. The picture below, however, shows the new arrangement where now people stand in lines with social distancing, hand washing first before they go to receive the food, and also using masks.
Our work in food security was also never stopped, even during COVID. People continued to still do their work in agriculture. What had to change was that instead of doing trainings in classrooms, now training was on the field, more hands-on, following COVID-19 prevention guidelines. And instead of having the big farmer groups, we downscaled to 8 participants per group following the guidelines.
And I think, as you can see in the picture, to the far right is a lady with a big smile. I really allowed that picture to be shared because I found that smile to be really infectious, and with a thumbs up. And you can see that MCC badge there. This is what MCC is all about. I want you to know that the support you give MCC does not only put food in the plates of the people that need it. It gives them joy, happiness, a sense of belonging, dignity, and a reason to aspire to see the next day. Thank you for your support. These, the smiles you see even during the darkest hours when the world is struggling with the pandemic, are not only infectious, but they are a sign of hope. A hopeful future is within reach, and with your support and your prayers and the way you share your gifts and time, as you have done today to listen to us, we know we can do it. One of the things that was so interesting and intriguing was the agriculture results in some communities, despite COVID. People are producing amazing, nutritious vegetables. You can see a group of farmers there with masks, and we're taking a lesson on spinach production, cabbage production, and a vegetable we call sukuma wiki. I think you call it kale in the US. So this is exactly what is happening. Like we said, we know these are dark times, but we want to pause and thank God for the gifts that we together are able to share with the world, bringing hope even during the darkest hours. Look at the maize crop. Fortunately for these farmers, COVID-19 does not affect plants. So they are able to produce what they should, and they are doing it extremely well. I will tell you that my mom is a champion farmer also in conservation agriculture. And one day I asked my mother, I said, you should be very disappointed because of COVID. I'm sure it has affected your production. It has affected how you used to fellowship with other women, and now you can't. It should be very disappointing, Mom. And she said to me, my son, I decided to look at the positive side. The positive side is that I no longer have to be in groups with other women, so I can spend more time in my little farm. And my little garden is going to produce more, because those crops are my hope. They are my friends. They don't give me COVID. I can play around them as much as I can. And in the end, we have food security. I thought that was a positive spin that I had never thought of.
Another thing that is happening too in light of COVID is that our partners have embraced new ways of sharing information. We have the text platform, which is being used by some of our partners to share messages on COVID prevention, as well as just passing information to do with even conservation agriculture. This has been especially helpful because this texting platform does not necessarily use Wi-Fi or a complicated system. Even the most basic of phones can receive these messages. And this has been very empowering to people who are in the most remote places who would otherwise not get information. Cash transfers too are also now being done as a way of keeping the projects going without necessarily having people to go in some of the places that are now difficult to go because of the travel restrictions.
Well, I know some of you gather every year to make comforters, to pack hygiene kits. I know that MCC material resources are distributed everywhere in the world, in all the countries that we serve, to bring the much needed relief. I do understand that a lot of people ask questions about why we still ship things abroad. I want to confront that today and answer it for you. In refugee camps where people have no access to cash and have no access to resources, when you ship a comforter or when you ship a hygiene kit, it is probably one thing that they can own as theirs. It is probably one thing that they can have in their name that they can get without being exploited or without having to go out there and risk themselves from the conflict. In our region, some of our partners have actually learned from how you do your material resource production. And they've decided that they would also make their own face masks, their masks, which is the picture you see on the left. Those are masks that people were trying to produce on their own with support from MCC. You can see that to the right are school kids with face masks that are made at home. So what we have seen is that people are also doing something on their own, in addition to receiving the support that you have provided. And that complementarity that is there, to me, is the definition of what we call Ubuntu, which means I am because you are. To me, it is the definition of dignity. When people receive so much love and generosity, that they also try by all means to help themselves develop the skills to produce some of these things that are needed. The support that you are giving is making a big difference, not only in terms of relieving the needs that are in the community, but also in setting an example for how communities can also work together to help fight the pandemic.
Hand washing stations are also being done by some of our partners in response to COVID. On the picture is an example of more of the complicated ones, but on the far end is one that is mostly common in the community, that only utilizes the logs and the jack. This one, we call it the tippy tap, where you step on the log and then it tips the bucket, and then you are able to wash your hands without necessarily touching the hand washing station. We are very grateful for these technologies that are user-friendly and that require very easily accessible materials that the locals are able to get.
I once joined a conversation at a coffee shop with 3 guys working in different fields that I will not mention. And they said to me, name one thing that your organization is popular for. And I said, innovation. They said, come on, everybody's talking about innovation. I said, fair enough. I said, frugality. They said, what? I said, we are frugal. And they said, say more. As you can see on the picture there, if you look at the technology on the right that Thelma just described, how many dollars do you need to make that one? You need an empty container that you have already used, and you need 4 sticks and a rope. This is what MCC do, folks. Using the resources that you provide carefully and intentionally, bringing the much needed impact that is accessible even to those that do not have. As an African myself, allow me to make it personal. I feel proud when an organization is connecting with communities in ways that empower them by bringing technologies that is within reach, that can be replicated, that are less expensive, but highly efficient. As Thelma said, there are no dangers of contamination as a result of touching the hand washing station. And of course, water is saved. And when water is saved, it means a reduction on the burden for women who traditionally have the responsibility of carrying water. We spoke about climate change. You can now see the connection there. Because of climate change, water sources are dry, and people are now getting water from faraway areas. But as we all know, because of COVID-19, hand washing is no exception. So MCC comes with appropriate technology that is affordable, that is accessible, and that is efficient. Of course, I will just brag a little bit on behalf of Mennonites. I know Mennonites don't like bragging. I will brag on your behalf. These technology also are the best bang for your dollar. When you give to MCC, this is what you get. Technologies that transform life, but are the best use of the resources that we have.
Also, in addition to other things that MCC has been doing in response to COVID, it has helped revamp isolation centers. For those that have traveled to Africa, you know most of our homes are quite small, and we do a lot of communal living. Ideally, a home would have 3 rooms, one being the kitchen, and then there is the girls' room and the boys' room. And so isolating is a big challenge when one is infected. So we are very grateful for the support that you have been giving, that you continue to give, because through this support, MCC has been able to develop and also revamp isolation centers. The one with the beds that you see to the left is one that was done in Zambia, and the other one was done in Zimbabwe, in Mwenezi. And so we're grateful for this support.
Okay, now let's talk about the big one. When a pandemic hits, who is the most effective responder? Well, in Canada, where I was, it was the Ministry of Health. Health services responded. They provided information. CDC did responded. They provided information. But in Africa, we all know that traditional indigenous knowledge systems are at the core and backbone of how Africa responds to pandemics. When COVID hit us, we all relied on the scientific knowledge about how to protect ourselves from COVID. It was World Health Organization, CDC, Ministry of Health, everyone. MCC saw a gap. The gap was that traditional indigenous knowledge systems were not being leveraged to help prevent, to help educate, and to help manage the COVID pandemic. In the picture there, to the far left, there are 3 prophets and a lady who is kneeling down and being prayed for. I want to share a story with you so you can see how these indigenous knowledge systems can be vital public health agencies that can advocate, that can educate, and can help prevent a pandemic. People are poor. Because people are poor, they are not able to afford to get medical assistance. They are not able to pay for consultation fees. As a result, they rely on their prophets and on their sangomas or the ngangas or the traditional healers, if you like to call them. Now, when the COVID pandemic hit, the most popular people, where people were going to become the prophets and the traditional healers. Why? Because the COVID guidelines were saying, if you have any signs and symptoms of COVID, you have to isolate. So if people go to the hospital, they knew they would be isolated. And for them, isolation just meant that they no longer are able to produce or to work and get food for their families. So rather than going to the Ministry of Health, they started going to their sangomas and to their prophets, who in this case were doing what they know best, praying for people while touching them on the head, touching them on the shoulders. If your chest is the one that is painful, the prophet would touch your chest and pray at very close range. So that meant that these prophets, even though they wanted to be helpful, they were now actually at risk, and they were also at the risk of infecting other people. The same happened for the traditional healers. You can see in the picture a traditional healer there with all his herbs that he is using in his shrine. Now, MCC, again, respected these traditional knowledge systems. Number one, by ensuring that there is a proper coordination mechanism between the Ministry of Health and the prophets and the traditional healers in Mwenezi district of Zimbabwe. Number two, they assessed how these knowledge systems are used to cure or to prevent or to assist those that are sick. And they discovered that they pray to people by holding their head or holding their chest. So what did they do? Instead of disempowering them by telling them that, please don't do that, they knew that they would never listen if they would say that, because this is their way of life. So they introduced a stick. So in the picture that you can see is a 1 meter stick. So they said, you can still touch the head, but just use a 1 meter stick. By so doing, they are ensuring that people are away from the person that they are praying for. They also introduced masks, and they said, please be in a mask. You can see the prophets are in a mask. They also introduced a very funny but innovative approach where they say, power to the patient through remote sensing. You see those two prophets are releasing power to the patient through remote sensing. They are not touching the patient. They are 1 meter away, but they are stretching their hands towards the patient. This became very important and very popular among prophets. Everyone felt supported. They knew they are no longer at risk. They knew they can protect their clients, and they knew they could continue with their business. This is one example where MCC worked to bridge the gap between scientific knowledge and traditional indigenous knowledge systems. Now, let's go to the traditional healers. These people heal people through the medium spirits. A spirit comes on them, and when the spirit comes on them, they forget their name, they don't know themselves, but they now have the ability to foretell, to predict, and to heal. They can now prescribe the drug. So MCC, through its partners, realized that when this person who has been taken over by the spirit, when he has been taken over by the spirit, he is no longer himself. So he is not able to protect himself from the COVID-19 pandemic. He can touch the client, he can sneeze on the client, he can scream and, pass all the, it's really not safe. So what did they do? MCC supported its partner to summon the traditional healers, have a feast for all the traditional healers, let the spirits descend on those that get the spirits for healing, and then ask for permission to say, we know you are the spirit, you are the one that will come and descend and give this person the healing powers. We are letting you know there is now COVID-19. How can we work together so that the vessel that you use can also be protected so that you can use it again tomorrow? Wow. Whew. This is community development. And most people think that development is just physical, where you move things. It can also be very social. And when it's social, and when you share our systems and knowledge, expertise, and we bridge the gap between science and traditional knowledge systems, that is the sweetest part. And thank you for your support. Because of the support you give to MCC, we are able to respect the communities, to respect their value systems, and work alongside them to help them, to make them feel empowered and help fight the pandemic.
Work on gender has also continued. This is work that started firstly before the pandemic, when MCC was working on engaging men to exercise healthy masculinity. And this work continues despite the COVID crisis. You can see in the picture, this man cooking a meal, demonstrating to these women how he prepares this meal. And this has been extremely exciting for us to see, because in most of our African cultures, they tend to be very patriarchal, and seeing a man cook is almost taboo. But MCC, through its work with men on the Gender Forum, has been able to engage men to promote healthy masculinity in ways that have transformed society.
And to just put an icing on the cake, that was before COVID. These are the men that participated in the Men Can Cook competition. It's almost like the MasterChef version, but except that it's now in the village and people are cooking. So men learn how to cook from their wives, and then they compete to see who gets to make the most delicious meal. Women are the ones that judge. You see how MCC is now seeking to transform and build healthy masculinities, as Thelma said. And one thing I particularly like about this approach is that when men win the competition, they don't get gifts or presents that are normally or traditionally associated with men. They get presents that are traditionally considered feminine. In the picture, they are holding pans, they've got teapots. And what this do is that when the man takes this pan home, okay, can we try to imagine this, folks? You take a pan home as a man who is traditionally would never talk about pots and pans, and here you are winning a pan. So when you visit some of these households, you are either served food by a man, they can even eat the meal and say, oh, today I was not the one cooking, you could have tasted my food. And sometimes you can also hear the wife saying, hey, be careful with that pan, it belongs to your dad. So that is very transformational in societies that are really very patriarchal, because pots, pans, and plates belong to women. So again, look at the triple impact of the dollar that you have invested. To begin with, women and men are working together to address a common problem, which is household chores. Women have more household chores than men. Now men have learned how to cook, and now men are actively engaging in conversations about cooking and about looking after assets that traditionally are known to be for women. And that is transformation. And this is why we are excited. I once said to Thelma, because for me personally, to be honest with you, I started cooking when I went to Canada. That's when I started cooking. I never cooked, and I have to confess, I would not cook. My wife would cook and serve the meal. When I went to Canada, then I said, oh, now I have to cook. But then when I then went back to Africa to see this project, I came back to Thelma and I said, I wish my dad was alive. He would have seen what is now happening, and he probably would have enjoyed this. Sometimes men want to help, but they don't have the skills. So MCC understands that. We encourage you also, MCC supporters, to think about this in the church. How are roles in the church divided? How are we engaging with men and women in the church? Are we reinforcing stereotypes? Are we breaking barriers? With the support you give us as MCC, we are indeed breaking barriers, and we are bringing transformation. So this is all we have for you today. Thank you for giving us a time to share these stories. One of my friends in Afar once said, when you are part of the story, when humanity is on its knees, count yourself blessed. I count myself blessed because I'm part of the story. But I am thankful for your support, because I can only be a part of this story because of you. More often, donors feel like they are far away from the story. I want to encourage you today and say you are not as far as you think. You are so close, because you are the reason why we have hope, you are the reason why we have energy, and you are the reason why we are hopeful for a better and successful Africa, for a better and successful communities and partners that can work together, bringing relief, development in the name of Christ. I also want to say to you, thank you for this time you spent with us listening to these stories. To me, I feel like this is the new church, the church that ministers to the spirit and the physical needs of those that are poor. Thank you for using your Sunday, which could be a day of rest and a day of fellowship with friends, to listen to the work that we do. And to Eric and your team, thank you for the support that you give us. We really thank you for all the work you do and for being faithful servants. All the donations you give to Eric and team are reaching us. And as an African myself, if something was wrong, I would speak out. So take it from me, Eric and team are doing exactly what you asked them to do. And from this presentation, judge for yourself if your resources are being used well. Thank you. Back to you, Lars.
So thank you so much, Thelma and Pugeni, for that very interesting and informative presentation. Excuse me. This is an opportunity now for those of you that have been enjoying the presentation to actually interact with Thelma and Pugeni. This is the payoff for showing up instead of just watching the video afterwards, because you have an opportunity to actually ask questions yourself. So I would invite you to either put something in the chat, or even better, to go ahead and turn on your camera and unmute yourself and ask Thelma and Pugeni questions yourselves. We have a good group of folks here that have a fair bit of experience, like Pugeni mentioned earlier, and I'm sure there are some good questions that this presentation has come, or maybe questions that reach beyond this actual presentation. So we want to invite anybody that has a question to jump in and go ahead and ask it at this time. And while we're waiting for a question, I have a quick one. What partners are doing the cooking classes, and what country is that in? Can you tell us that?
The Men Can Cook is being done by our partner in Zimbabwe, Score Against Poverty.
Okay. Is it getting beyond Zimbabwe, or is it pretty much, is that concept sticking in Zimbabwe at the moment?
So at the moment, it's a concept that we are now at a place where we can now replicate it in other countries. MCC is now paying special attention to this and trying to see opportunities to replicate. The reason why this particular community was very successful with this was because they did a very good gender analysis. They also looked at how can we work alongside men for the benefit of women and girls. And when you start to talk gender and you are focusing on men, it seems like there's a problem there. But these guys were so creative that they said women should be the ones responsible for developing the content and developing the evaluation strategies and for validating the approach. So it says men can cook, but maybe we should write on my credit card statement, there's always that fine line that they put that you don't pay attention to. We have to put a fine line that created by women. So this was actually designed by women. It was women themselves sitting together under a tree and saying, this is what we envision for our community. We want a community where men can cook. And then MC said, how can we do this? And they came up with this approach. So now MCC is now ready to try and test it out in other countries. And I am so proud of women that are so strong and can use safe spaces to come up with such innovative ideas. And even the prize giving is done by women. The validation to say this meal is the best meal, it's done by women. The approach is done by women. They are the ones that design the approach. Men do it on their own, but with a lot of guidance and input from women. So what a beautiful way of just engaging men for the benefit of women and girls in a very transformative manner.
That's great. That's great. Other questions that folks might have?
I see Elizabeth's hand was up. Was it Elizabeth? No.
I just have a comment, and that is that I just feel so happy to hear those stories of empowering people, and, like working with the traditional medicine doctors, and the way you approached all of that, it just seems so right. And it makes me very happy to keep on supporting MCC because of that work.
Thank you very much, Louise, for that feedback. We really value it and appreciate it. Even for us too, it is really empowering when you work for an organization that respects people's values, beliefs, and indigenous systems. And in some ways, what a beauty also for you as MCC supporters to be able to share a testimony about the beauty of working collaboratively together with indigenous people. Because more often we tend to dislike the approaches that indigenous people have. But from what we have seen as MCC, that is exactly where change will happen. And the change that happens is really for the people at the bottom of the pyramid. Because people that are really poor are not able to access the scientific knowledge and everything. And the only conduit you can use are those traditional systems that exist. So I am also equally proud of you, and thank you for your support, Louise.
Pugeni, tell me again what countries you are working with.
Okay, I will leave that to Thelma.
Thelma. Thelma, it's very nice to meet you. I've communicated with Pugeni in the past, but I'm so happy to see the two of you together.
Good to meet you too. We are working with Southern Africa, Central Africa, and Nigeria. And so our countries of responsibility are Zambia and Malawi, Zimbabwe, and we also have Mozambique, Rwanda, and Burundi, and Nigeria, as well as the DR Congo.
Whoa, oh my goodness. That's a big, big place. Well, you've made me very homesick. But that's a different arrangement. I hope that's going well for you.
Thank you so much, Suzanne. I think we appreciate the work you guys did, because you and team, Bob and Judy, you are some of the people that created this platform that we are using. So thank you for doing this work so well. It has been so easy for us to come in and also take over from what you guys were doing. We still learn from the exemplary leadership that you left. You left a huge footprint here, and we miss you too. We miss you too.
Do you ever get mad at Canadian Food Grains Bank or anybody or other donors? Remember, we used to get mad at you.
Well, I think that we don't really, for me, because I worked with PLDR for 8 years, really looking, and my work was really with CFGB. So 95% of my work is CFGB. What I have done is I've taken it as an opportunity for education. So rather than being mad, I've taken it as an opportunity to engage in conversations where we can learn from each other. Because sometimes we need to bring, you see, this is why Thelma and I are so excited. And some people would say, wow, Thelma and Pugeni, they just won a lottery. They were in Canada. And what are they doing? They're now going back to Africa, you know? But what helps us is to be really at the center where we are so close to the action and are also able to connect with you so that we can bring the good news. So with CFGB, it's the same thing. We feel that we are now in a place where we can converse with them using tangible examples of what is working and what is not, so that they can come to speed with what is required.
Well, thank you. I guess I'm just remembering times when we thought we were doing that with you and it didn't get the result we wanted. I'm just kidding. I'm just kidding. Just kidding.
No, Suzanne, you just brought another topic here. So I will say it because I really want to say your concerns are correct. So when we look at development, it is challenging. So a lot of people see Eric and team working tirelessly every day. And to them, it's a very simplified process. I give a donation and the donation goes to the community. There is a lot of thinking through that goes in there. When you see Eric, please buy him a coffee. Or when you see that, there's a lot of thinking that goes in there. Because there are so many forces that are fighting, that are kind of opposing each other. MCC is trying to be a grassroots-based organization, working with local people, respecting indigenous organization and indigenous systems. Other donors are trying to be these high-level donors. They have a different way of working and thinking. So we are so very fortunate that you as our supporters are able to understand and allow us to work in ways that bring relief and development to the people in ways that are respectful of their cultures and in ways that respect their countries. So what is now happening, you'll be surprised, Suzanne Lind, that what is now happening here in Rwanda as of last week is that a lot of organizations are now trying to localize. Because COVID-19, going back to our topic, COVID-19 has meant that a lot of expatriates have left Africa to go back home. Now it has created a vacuum. The so-called expats are no longer in Africa. They are now looking for vaccines in their motherland. Now, the challenge that it is now created is that I have seen that I will not give names, but I've seen that organizations here in Kigali, in Rwanda, are starting to localize. They are now registering as local entities. And what a prophetic stance MCC had when they started working with local partners. So we are now ahead of everybody because we are already in the game and we are working with local partners. So they were asking me, hey, what are you doing about localization? I said, what? I can't hear you. What are you talking about? You see? So this is really, Suzanne, what you said is true. Like the world is really changing and this pandemic has really changed a lot of things. And I'm sure even CFGB and other organizations, they are appreciating the partnership model that we have. It's a lot of work. Our partners need a lot of capacity building. I respect CFGB because they are truly, truly committed to the relationship and the partnership. But then that's where MCC comes in, supporting through our young adult programs, through the service workers, through some people from the region who are also now volunteering to serve in other countries, through people like me and Thelma, to really bridge the gap so that we all speak the same language. So we are all connected and we are all connectors. So let's keep doing that.
So Pugeni, this is Judy. You started kind of answering my question, which was how COVID has affected MCC's operations. I mean, you talked about how you had to adjust with partners and so on, but are you running into issues with workers or with the issues of vaccines and so on? What are you finding?
I'll take it. Okay, so what we are finding is that our workers, our partners, staff, some of them have also tested positive to COVID. So this is not as rosy as like, okay, no, MCC is immune to this thing, no. Our budgets have also, I think you remember when this started, our budgets were really affected, but we are so thankful that giving has been very good and our supporters are doing a tremendous job, and to that we are truly thankful, and thank you for doing that. Now the other thing too is that when it comes to vaccine access, we are here in Kigali, we got 300,000 doses of COVID-19 and the government had a distribution plan. So they said that they would start with the essential services. So some organizations that have been listed as essential services includes NGOs that are working in public health. Now, this is where the dilemma comes for me, not for MCC. I'll speak for myself. Do I get registered as an essential service and get the vaccine? Or do I leave or let the lady who is living under the valley with 7 kids, is a widow, has no job, get the vaccine? Now, I know when we talk about the way vaccines are distributed around the world, we always think about the US and saying, oh, how is the US doing? And it's important. But we are also saying, even at the micro level, we also see, we have those big questions. When I, as Pugeni, am considered essential service, is it for me to go in the line and get it? Is it for me to let that lady sitting there selling tomatoes or not selling anything with kids that are hungry get it first? So this is really a challenging issue, and I think maybe Thelma can speak to this.
Yes, no, I agree. It has really been a big challenge. And in a lot of the other countries in Africa, we do not know when they will get the vaccine. or if and how that will be rolled out. Rwanda has been quite exceptional. They have most of their elders vaccinated now, and most of their essential services. But that is not the case in the rest of the other countries that we work in. For the most part, it's questions: when will we get it? And if we do get it, which one will we get? And will it be for free? Will the government afford it? Or will it be something that we'll have to buy? And if we have to buy it, will we be able to afford it? Will it be possible to get the whole family vaccinated? So people have a lot of questions, and they don't know when the vaccine will be available to everyone. But what gives people hope in this day is the help that they continue to receive from MCC and other like-minded organizations. That is what has kept food on the table. That is what has kept people hopeful to say, maybe we have not been forgotten. Maybe we're still remembered. Maybe something will come.
A quick follow-up on that one. I'm wondering, do you feel like the vaccine is accepted in ways that anybody that has opportunity to get it will take it? Or are there people that are suspicious and not wanting to take it even if it's available? Here in the States, obviously, we have lots of people that choose not to get it because of political belief or other things, suspicion. And I'm just wondering whether that's the case in the areas that you work at too.
Oh, thank you for that good question. Actually, it is the case. And I don't want to sound like I'm blaming the first world countries. But you see, a lot of countries are looking to America, to the United States for advice, for vision, they are also looking at Europe. They are, looking at Canada. So when they hear that Europe is now stopping a certain vaccine, for example, that really causes confusion. Everybody here panics and say, oh, should we even take it? If they themselves that manufacture it are not even confident about it, what about us? So there are all these issues that are there. And to me, this is where I feel like when we, even as we talk, let's think about the impact at global level, the reach at which what we do. Like in this case, we really see a lot of people that are not sure about taking a vaccine. I know a person who is on the list for receiving a vaccine and they've not taken it. They are definitely essential service and they deserve it. They've not taken it. So that is a big challenge that we have. And the other challenge that I want to also mention is to the supporters, to say this is now where you see that MCC's approach is very useful, because MCC combines all this work with peace building. So when we do peace building, these are some of the conflict issues that we always touch on. So there are tensions in the community about, are these vaccines safe? Should we take them? And MCC now, we think that when you give to MCC, especially for pandemic, for response to COVID-19, this is an area that we want to now start looking at carefully and raising awareness on how to accept vaccines. Because right now, vaccine acceptance has not been on the menu of the work that we do. It has been really the preventative measures and the management of COVID. So we will try by all means to work on that as well intentionally in our region. We don't have a project that is specifically looking at promoting vaccine acceptance. And with the support that you are giving and also learning from these conversations, that's an area that we need to strongly focus on moving forward.
Thank you for that. Other questions from folks that are on?
So if people do not have questions, I can also ask a question if I'm allowed.
Of course.
Okay, so my question to you today is, we understand that a lot of times as NGOs or as funding organizations that are working with local partners, when we go out to help people, we come back with stories to you. Is there anything that you always wish, like, I really wish MCC could talk about this thing? I think that to us as people on the ground, it is very good feedback because you are the drivers of this movement. You are the people that are supporting this movement. We are not going to talk about it, but I think we can write it down and remember it. Is there anything that you would have accepted, you would love to hear from us, where you say, we wish one day MCC can talk about this topic?
Go ahead and unmute yourselves and ask.
Well, yeah, I'll say something. I've found out through my own life that I've learned more from the things that I did wrong than from the things that I think I did right. And so we hear a lot about all the good and positive things that MCC is doing. But I've always felt that it would be that we should work harder at finding a way to share the mistakes that we make, because it also makes MCC a more human organization if they're willing to talk about their mistakes. So that would be my comment on what kinds of additional stories I'd like to hear.
Thank you, Tim. And you can take me on that next time. And hopefully you guys can come again and we can talk about it. I'm prepared for it. I think I have already mentioned that we need to do a little bit more work on vaccine promotion. And definitely you are right. We do have learnings that we have gained over years and things that we have adjusted and things that we continue to evaluate and learn from. Thank you for that feedback.
I would like to know, from your experience, you talked about partnerships, and what are you most excited or proud of in your partnership connections? And you talking locally over there.
In terms of the excitements in our partnership relationship, thank you, Edward, for that question. I think that the real joy for me, where I really feel that this is the part that excites me, is that MCC is able to connect with the grassroots organizations that may seemingly not have the capacity to deliver, those perfect reports that we always want to see, yet are the ones that are that are really the catalysts of development in those communities. I grew up from a village in Menezi. I will tell you, Edward, that one day someone asked me, what was your first encounter with poverty or hunger? Because I talk a lot about food security. So someone said, what was your first encounter? Would you remember? How did it feel like? I think they were youths, right? It was a church youth gathering. This young boy was so concerned and he wanted to understand. And I just answered simply to say the day I was conceived, that was my first encounter with hunger and poverty. Because my mom had anemia, she was already malnourished. She was 16 years old. She got married at 15. So I said, this is my story. So for me, when I say I really love this partnership model that MCC have, it's because I know that is exactly where change should take place. It is so close to the community, number one. Number two, I also appreciate our region because of its connection to the church. If you go to Zambia, we have amazing work with the DIC Church. When you go to DR Congo, we have an amazing work with the Mennonite Church. And some of these churches did not have structures in place to be organizations that can respond. But MCC started forming volunteer committees in those churches and supporting them with training. And now they are programming CFGB projects, huge projects that are amazing to watch. We also have got partners that are owned by refugees, like Oasis in Fizi, in DRC. Refugees collectively coming together to form an organization that MCC has treasured, has nurtured, has mentored, has accompanied, and is now really doing amazing work. In the Dzaleka refugee camp in Malawi, those are refugees coming together to make a difference. So for me, those are the aha moments where I really see development being simplified to mean working together with families that are in need on the ground, where their needs are, and really speaking to those people that are affected so that our work reflects their needs and addresses their concerns. I really find a lot of joy with that.
For me, it's how MCC works with partners in ways that are respectful of the local context and the local cultures. I have always found that very inspiring that MCC does it that way, especially its work on gender has been very touching for me. Being a woman that is from Africa, I understand the challenges that women go through on a daily basis and the amount of work that they have and the toll that it sometimes takes on them. So for me to see MCC engage communities in ways that are respectful to them and also help men share their privilege and their power in ways that are empowering to women and help develop healthy families, that for me is just, yeah.
And Edward, I will also say something interesting to say. When we work with partners, another thing that excites me the most is the MCC donors. Because MCC donors know that when you give to where needed the most. That means it gives MCC the flexibility to listen to these local partners and really address their needs. Imagine if MCC donors were just so much about, I want this thing, I want this thing, I want. How would Eric even plan about a community in Mwenezi that is trying to work with prophets and traditional healers? Now, I am so proud that our donors are respectful of our partners, because when they give, they understand that the needs, the priorities have to come from them. So they give where it's needed most. Thank you for doing that.
Thank you for your testimonies and blessings to you and all that you do. We thank you very, very much for what you do.
Thank you.
Thank you.
Any last questions? We are almost out of our time here, but if there's one more pressing question, we'd welcome it. So hearing none.
I have one.
Okay.
I'm going to start my video just a minute. Thank you so much for sharing of your life and your energy and your work on behalf of MCC. I'm curious if, none of us can see the future, and maybe that's a good thing, I don't know. But I'm curious, as you sit where you sit right now, if there was one thing that you could have, one thing that, and it doesn't have to be a thing, it can be an idea, it can be what's one thing that would be helpful to you now, in these days, in the work that you're doing?
Wow, that's a very challenging question, but really meaningful one. Thank you for asking us. It's very rare for us to get such a question to say, what would be it that you would love? I think for me, I think I will speak for myself. I think that if we could, I think if we could have our donors work closely with our provinces to come up with ways that they can also come, see and celebrate the good work that MCC is doing, I think I'll be so happy. I really feel like that has been my wish all the time. When I see those beautiful stories, I think of you all the time. I say, oh, how I wish. And I think Eric and I have spoken. Eric is a great advocate on climate change issues. He's like, Pugeni, the aeroplanes will be polluting. So how can we cut those emissions, you know? But the truth of the matter is that I want to start a carbon offsetting program that MCC can do to allow our donors to come without feeling guilty because there's an offsetting program, so that they can come and celebrate this good work that is happening on the ground. The support we are getting is awesome and the work is amazing. That I can tell you. That I can tell you. Thelma.
Yeah, no, well said.
Well, with Thelma's amen, we will say thanks so much and invite, I think Jen's gonna put a couple things on our chat link to talk about some upcoming events that you might want to check out. But Thelma and Pugeni, thank you so much for taking the time out this afternoon and sharing with us. It's just always so inspirational to hear you, the wealth of knowledge that you have, and just for being our voices and our hands from this country as you are doing the work that you're doing, communicating and sharing the opportunities that our donors want MCC to be doing, and you are the people that are making that happen. So just thank you so much for doing that as our ambassadors, and so thank you for sharing that with us. So check out the chat side if you can have a chance. There's a couple different upcoming virtual events. There's this next Thursday, there's a meat canning webinar. If you know any meat canners, potential meat canners, that's an exciting program that we always need young, at this point still young men to run on the canners. So please invite them to check that out. We have gender and COVID-19 stories that are coming up in April, as well as some different online auctions that are supporting the work through MCC. We have a Nebraska auction that's going to be coming through this next weekend. April the 10th, there's a couple different auctions that are happening. So feel free to jump in there. And then if you missed the chance to see the Alumni and Friends gathering that happened last Wednesday, there's with Katie and Andrew Gettert telling about some of the work that MCC is doing in Ukraine. There's a link for that one as well. So those are just a couple things that you can check out. Also, I always encourage people to go to mcc.org, to our website, to read some of the stories. If you're looking for uplifting stories about on the internet, mcc.org has some great stories about the work that MCC is doing around the world. That's just encouraging. And so feel free to jump to that too. So Eric, we're going to turn it over to you, and you're going to for a closing prayer, but thanks again to all of you for showing up here.
Yes, I just want to echo my thanks to everyone for coming, for your support. And, you know, Pugeni and Thelma, what a wonderful presentation. You give us a lot of credit, and I think that really you're the ones that we should be buying coffee for. So We look forward to maybe someday hosting you here in person in our region, and to be able to do that. But we thank you for all the ways that you are really the ones connecting with partners and empowering and supporting the people in the context where you work. So thank you. I'm going to end with a benediction. This comes from our new hymnal, Voices Together. There is a response. It simply says, Jesus, lead on. So when I indicate, you can say along, you don't have to unmute, but if you feel led, you can say that with me. From where we are to where you need us, Jesus, lead on. From the familiarity of what we know to the wonder of what you will reveal, Jesus, lead on. To transform the fabric of this world until it resembles the shape of your kingdom, Jesus, lead on. Because good things have been prepared for those who love God, Jesus, lead on. Amen. Go in peace.
Thank you.